Hi, and thank you for joining us for this session, Acupuncture and Physical Therapy to Manage Side Effects and Pelvic Pain. Acupuncture and physical therapy are two useful modalities that can improve quality of life for ovarian cancer patients. Danielle James is the licensed acupuncturist and herbalist, and she's an ovarian cancer survivor. Dr. Heather Jeffcoat is a pelvic floor physical therapist, and she will offer her perspectives on reducing pain during sex. You can view both of their bios on the event website. Thank you both for being here, Danielle and Heather, and I will turn it over to you.
Hi, I am Danielle James, and I am an acupuncturist and herbalist in Los Angeles, California. And thank you for tuning into this presentation. And my goal is to answer some of the most common questions that I hear from patients regarding acupuncture and focusing on side effects from chemotherapy and recovery from surgery, and a few little basic information about what to know if you haven't had acupuncture before. So, acupuncture is one of the branches of traditional East Asian medicine. Herbal supplements, exercise, Chinese nutrition, meditation, and body work are often integrated into treatment plans for an overall kind of approach to a balanced and healthy holistic lifestyle. Acupuncture refers to the insertion of thin, sterile, single-use needles being inserted into specific points on the body as a treatment for a variety of symptoms and related conditions. Alternatives to needles can also be used, including seeds, which look like this, as an example, magnets, and acupressure. This is a way to receive treatment if there are concerns due to low platelets or white blood counts, especially if you are having issues with thrombocytopenia or neutropenia during your chemotherapy, because some doctors may advise, to reduce infection risks or bleeding. This can also be applicable in cases if you've had blood clots from either your cancer or your medications. And the World Health Organization has a list of over 100 symptoms and conditions that have evidence supporting the use of acupuncture for treatment. Relevant to ovarian cancer, this includes cancer pain, low back pain, depression, insomnia, musculoskeletal pain, nausea from chemotherapy, digestive issues, and headaches that can also be a side effect from treatment. There is a much longer list, and I'm going to go over a few others as well. But I want to talk a little bit more about the nausea and neuropathy. And you can do this when you leave after a chemotherapy session, if you're not able to get to an acupuncturist right away, or, when you're taking the post-treatment nausea medications. And it's called pericardium 6, and it's located on the inside of the wrist. It's about 3 fingers above the crease in the center. And it's also used in a wide variety of treatments and is part of many point prescriptions related to women's health. It also is used in the treatment of anxiety, and even some of the pain doctors are familiar with this point. In fact, I had a pain doctor ask me about this point specifically because she had heard that it was really helpful for use in reducing anesthesia side effects, and will recommend it to patients. And this point is located kind of right here on the wrist. So you can take your hand and bring 3 fingers from the crease in the center. And I have put a little seed right on my wrist in this area. And actually have an image of that. But this is basically, you can just press on this point. You can also get seeds on Amazon, just as a side note, if you're unable to find a practitioner in your area. A couple things with neuropathy. I know that's a really common thing that people will be looking for support with, especially because it's cumulative going through the carbo and taxol parts of the treatment, and and some of the other medications. And in addition to supplements that your doctor might suggest or allow you to take during treatment, like alpha lipoic acid or B6, you can also kind of press on your fingertips. So some of the acupuncture points for neuropathy are kind of located in between the fingers, kind of right in here. And you can press through here. These are called fasciae. Or you can use your fingernail and press on the tip of your finger, kind of like this. And it's if you feel tingling. And it can help kind of relieve the sensations and get the energy flowing in the area. So those are just a few things that are really helpful, because those are really, the neuropathy in particular can be a really debilitating symptom and can linger, after treatment. And so with acupuncture and acupressure, the common symptoms that they can reduce or are caused by chemotherapy that people most often come into the clinic with include nausea, pain, chemotherapy-induced peripheral neuropathy, hot flashes, insomnia, and fatigue. Other things that people may come in with can be related to anxiety, stress, and frequently there will be requests about help for boosting white blood cell counts, which is a little trickier to address. We do have some things that can help with that and supporting the immune system. But that is one that can be a little trickier, but it is a pretty common request. So additional treatment related symptoms that are including more pain, uterine prolapse, urinary incontinence, scar reduction, trauma, anxiety, depression, constipation, and diarrhea. So both this list and the last slide relate to conditions that are specified in the World Health Organization's list. Outside of that, there is, as I mentioned before, people will come in for help with their immune systems, and as well as stress, and insomnia, and those are things that are very common, both the side effects. To speak a little bit more specifically, with the scar reduction, acupuncture needles can be placed around surgical scars to help with that healing. It's usually advised to wait a few weeks after the surgery, depending on if you're on, blood thinners or other medications. It may need to wait longer. You can also have body work or massage to help reduce that scarring. And the needles are done, in a method that goes from the top to the bottom and then around. It might sound, considered with the size of the incisions that are common from the open hysterectomy, like that's a lot of needles, but that can be placed down into fewer. So it's to be like probably less than 8 to 10. Because I know that sounds like something that could be a lot. And this can be used for laparoscopic scars and other areas. And it just helps get blood flowing, moving through. The urinary incontinence and bladder prolapse are issues that generally we will refer to also see a pelvic floor physical therapist. But there are also techniques that we can do to help with that as well. And there's herbal formulas that are used for that, as well as hot flashes and anxiety that can be used post-treatment, as long as your oncologist is okay with it. There is some herbs that can potentially interact with the chemotherapy medications. And then so it's very important, if you are going to look into herbal supplements, to work with somebody who has experience with the chemotherapy medications, and to have a very open dialogue with your oncologist about, what you might be taking, and, and making sure it doesn't overlap. And if in doubt, stay on the safer side with that, just to make sure the medications are working. So most of that, it's very common that people will want to kind of pause until active treatment is done, and then working on the herbs incorporated into the post-treatment phase. So with the transitioning into that, so with East Asian medicine and wellness support, the herbal medicine and supplements are in California part of our scope of practice. That ranges a little bit from state to state. If you are not in a state where acupuncture includes herbal medicine, naturopaths are a good source of information for that. However, herbal medicine can also be practiced remotely. So you can work with somebody in a different state for that part of your treatment. With meditation, mindfulness and breath work are really important, including diaphragmatic breathing and just really getting all of your, and taking deep breaths, and also the mindful aspects of meditation and really being present. This can help a lot with keeping grounded, keeping calm, because, going through active treatment and then the anxieties with post-treatment, can cause a monkey mind. So it's really important to keep meditation in there to kind of keep some groundedness. With movement, Tai Chi and Qigong are traditionally associated with Chinese medicine. However, regular exercise, including yoga, running, walking, Pilates, anything is really, gentle is really considered important. This helps build what we consider qi, and it's like the good qi. And with dietary changes, there's a lot of holistic and integrative nutritionists will talk about Chinese medicine, and we have a kind of unique way of looking at diet and nutrition. So we will look at, both what's going on in the body and what we're seeing in the tongue and the pulse, which will usually take your pulse and look at your tongue and ask a lot of questions about your bowel movements, your libido, what you're eating, treatments, medication, diet, exercise, and with the diet, usually make recommendations to, reduce inflammation. There's also some dietary changes that can help with hot flashes. Exercise is also really helpful with reducing hot flashes. And then also body work. So the therapeutic massage, there's scar massage, and then cupping can help with releasing muscles. And then there's something called instrument assisted myofascial release, or gua sha, which is to scrape, which is another area that can be used. And sometimes you can see gua sha used for neuropathy. The cupping can be used for muscle pain and, and body work and stretching. And all of this can help a lot with the muscle pain that also can come from chemotherapy. And there are some points that can help a little bit with the bone pain that happens. That's a little trickier to treat because of the way that it works, especially if you end up having to take Neulasta or Neupogen or any of those related medications. Because the bone pain in those cases is actually how in part of the medication working. So with that, we're not able to do as much with that. And I wanted to be really upfront about that, because I have had people come in for appointments wanting help with specific to bone pain from their injections. And there's really, it's a really different type of bone pain than the achy bone pain. And there's a lot that can be done, to help with that naturally. Unfortunately, it's harder for us to treat. And, some common questions that new patients have, a couple top ones is, does my insurance cover it? So I thought this was really important to put into a slide, which is yes, by most plans, by major US carriers, cover acupuncture for pain and nausea related to site chemotherapy. It's included in most plans through the state exchanges as an essential benefit. It's also covered by Medicare plans. And that is just in the last month or two that, Medicare was covering for low back pain, and they've now expanded their coverage and their plans and the access. So more people are able to get access through their insurance benefits than a few years ago. And do I need a referral from my MD? Sometimes. So in most states with licensing requirements, an acupuncturist is designated as a PCP. This means you typically do not need a referral with any PPO plans and most HMO or EPO plans, as long as the person's in network. However, specific HMO networks may require a prescription. I've personally only seen this with one HMO network, and that is because in some regions they have acupuncture within their hospital network and organizations, and other regions, including Southern California, do not. And so they will do a prescription for services that they don't have within their own hospitals. With EPO plans, as long as the provider's in network, you're able to see them. And with PPO plans, you can go and you'll have a range of visits based on your plan. It can be anywhere from 12 to unlimited. And so it's really important to kind of check your plan and also check your area. A lot of time, a couple other common things that people will talk about with acupuncture is it being cost prohibitive or difficult to find a practitioner in a specific area. So I included a little page that has a couple pieces of information on how to find a practitioner in your area and different alternatives. And it's really easy to find acupuncture to meet all budgets, which is, really important. I know that, especially with the expensive treatments and, and related costs and time off work and, all the other things that go with that. And there are also a few programs that can offer scholarships to acupuncture for specific populations or specific geographical areas. Other common questions that come up is, does it hurt? That is pretty rare. You might feel a little sensation when the needle goes in. For some conditions, it might feel a little bit more uncomfortable. And usually the practitioner will talk to you about that, or if there's a point that's tender, we'll ask you to breathe through it. A lot of people will come in really anxious for their first visit and and I know with going through treatment and particularly with chemotherapy and hospital stays, there's a lot of getting and blood draws. There's a lot of needle fatigue that happens with going through cancer treatment. And so it's really good to, talk to your practitioner about that and, alternatives to make it gentler. I personally use the least amount of needles possible through the style that I treat. And it's something to just let the practitioner know. An acupuncture needle, just for a frame of reference, is thin enough that one needle would fit into a typical butterfly used for a blood draw. There are 25, it's 25 acupuncture needle ratio to about one standard butterfly needle. And they're very thin and they just slide under the skin. We take a lot of caution to avoid veins in most cases. And so there's very little bleeding associated with it. And we do sterilize the points, and the needles are only used one time. And those, are questions that people ask all the time, on their first visit or before they come in. And so I figured I would go over some of that as well, because it's just helpful to know. And it's really, and when you're looking for a provider near you, a couple things is check with your treating cancer center or a local cancer support program. A lot of the organizations, at least here in Southern California, have some resources available to refer people to. Or you can ask people there who are getting treatment, and other patients. And some cancer centers also offer acupuncture. I know at UCLA, for example, here in LA and at City of Hope, they have acupuncturists that are in the oncology units in the inpatient section of some of the hospitals. And, and then there are other centers I've heard about around the country that have acupuncturists going into the chemo center while people are getting infusions or able to schedule directly after. And, so it might be closer than you realize, it could be available as a resource. Another thing is checking your insurance. It can be difficult, as I've mentioned before, with finding somebody in network, and you can kind of get an overwhelming list by zip code. So sometimes what people will do is they'll check their insurance, they'll get a list, and then they'll take it somewhere that they trust, and ask that there if there's a name they recognize off the list. We do all specialize in different areas, and so some people might be more comfortable treating oncology patients, and some people might be more comfortable treating dermatology or orthopedics or something like that. So you can also ask lots of questions. It's really common for patients to email, like asking about experience with a specific issue, when they're kind of researching whether or not they want to see somebody, as well as looking for referrals. You can also find a local acupuncture school. There are several, around the country. Most do tend to be on the West Coast. There's also a few in Florida and the Southwest, Chicago, and several in New York, and I believe Virginia and North Carolina. And this is a resource that can help if you, for example, your insurance doesn't cover, or you're finding some cost issues. Is a lot of the local acupuncture schools will offer, reduced cost treatments, and it's usually done under a faculty supervisor with students who are working their way through school. I have held a supervisor positions at a couple schools myself, and a lot of patients will come in, and even to supplement their treatment with a regular practitioner, and it's also a way to, supplement your treatment, in a different environment, and get really good care, either way, if you see a private practitioner or go to one of these clinics. And you can also, in most states, you could go to NCCAOM to find a practitioner. That is the national, guild. California, we have our separate licenses. So, and we're under a different board. So California is a little different than the rest of the country. Each school usually carries alumni pages as well, where you can find people who've moved away to different parts. And I actually also included an email address for me if you have questions about that or help finding somebody. I can connect with links as well that I have. And a few other important things that people ask to wrap up with is, how does acupuncture actually work? So a really big thing that we talk about qi a lot. And to put it simply, we're working with stimulating the energy flow through the body by, activating specific points. With activating those points, we're able, and there's about 365 primary points on the body, 130 on the ear, several on the scalp, and various microsystems, including the abdomen, foot, ankle, hands. And when we're using those points, we're able to keep qi and kind of everything balancing. And we look at it as like qi or breath or life energy. We also do look at blood and other aspects when we're looking at the tongue and pulse. And you might hear, various terms thrown out, like liver qi stagnation or spleen qi deficiency or kidney yin. This has nothing to do with your actual liver or your actual spleen. I also think it's really important to include that note if you are looking into checking it out, because I have heard patients, walking out of a clinic after a treatment, talking amongst themselves or trying to Google what that means. So it's just a different way of diagnosis. So you can ask your practitioner if you hear any of those words, for a more detailed explanation. And, and it's a 1,000-year-old system, and it is used a lot in China and Korea and other countries directly in their hospitals. So we differ. The herbal medicine is not as accessible here, in our hospitals, or acupuncture as it is over there. But a lot of the protocols that are studied, actually are used in those countries as well. So there. And yeah, so you can feel free to reach out or screenshot with any questions, and I'd be happy to help answer them or connect you with a provider in your area. So thank you.
Hello, everybody, and thank you for attending my talk on sex after cancer. My name is Heather Jeffcoat, and I'm a doctor of physical therapy in Los Angeles, California. I am also president-elect of the Academy of Pelvic Health Physical Therapy. So after listening to this presentation, if you think that you need therapy to address pelvic health or sexual concerns, then please visit the website I listed below to find a provider near you in the US. I'm also board of directors of the International Pelvic Pain Society and very passionate about treating pelvic health and sexual health conditions, especially in women. I have been in private practice in Los Angeles since 2009, and I offer, along with my staff, one-on-one sessions with my patients so that they can truly get the time and the care that they deserve. This is my office, and I currently have 4 locations in Los Angeles. And our practice does primarily focus on pelvic health diagnoses such as persistent pain, especially pelvic pain, sexual dysfunction, bowel or bladder leakage and pain, urgency and frequency issues, both bowel and bladder, as well as pelvic organ support issues such as prolapse. And then we also see general orthopedic conditions as well. And I strongly believe that with a pelvic health physical therapist, they do need to also be a good orthopedic therapist, because a lot of my pelvic pain patients have a lot of other pain as well that needs to be addressed concurrently with their pelvic pain, such as low back pain or hip pain. So, from leading groups of female cancer survivors, of which I've led several, and there's always been women there with ovarian cancer as well, we all universally discuss sexual health. And that's kind of why I'm always brought in to discuss that topic. And universally, they're telling me that their providers are not bringing up sex, sexuality, and intimacy with them, but that it's always in the back of their mind or on the front of their mind, and they're not really given resources up front on how to manage these new sexual and pelvic health concerns that are happening and changing along with their body. And so hopefully by the end of this lecture, you'll feel like you have some resources to help address those concerns and even open up the conversation with your providers. So sexual health in anyone with a chronic illness is a major factor in how women rate their overall quality of life. And it's also a reliable predictor of emotional well-being. So it's a very important topic that should be touched on by every provider that's treating you. And that some of the sexual side effects that you're experiencing may limit your acceptance and continuation of certain cancer treatments and of surgical and chemopreventative therapies by some women that are at higher risk for cancer. And pain with sex is very common. The American College of Obstetricians and Gynecologists say that 3 out of 4 women report painful sexual activity that has occurred for more than 3 months at some point in their lives. And that doesn't even include a patient with like a cancer history or anything like that. And so there's also been studies that have looked at women specifically affected with cancer. And honestly, I feel like all of these numbers are significantly underreported. But it does say that more than half of women with gynecologic cancers will report painful intercourse. And I put this slide up because I think it's really important. And if you screenshot it, it's, I think going to be really nice for you to refer back to. But this was from a research study in 2015 that looked at the 9 domains of evidence for the ethical care of women and girls affected by cancer and in preserving sexual function. So I like people to kind of read this and reflect on this to see if they're getting all the care in each of the domains, but especially number 5 pops out to me, which is that patients want to preserve their sexuality, but they rarely ask for help. And so here we are, whether you ask for it or not, I'm here to help you, because I know that it's this stigmatized and sort of kept under wraps problem that is important to, I think, most women out there. The reason that sexual dysfunction may occur is that due to the ovarian damage and oophorectomy, that loss of estrogen that can that does occur creates instant menopausal state. And when you're in menopause, you get a loss of natural lubrication in the vulvovaginal area. You get tissue thinning, tissue irritation in the vaginal canal and in the vulva itself. And that can create pain with penetration or pain with like deeper thrusting, or pain anywhere along the vaginal canal. Also the anatomic alterations, so dealing with recovering from a surgery, scar tissue pain. Also there may be neurologic, myofascial injury for sure. And then it's a pelvic organ. So, if there's even a complete hysterectomy that's performed, we're dealing with changes in anatomy, and your muscles will be affected by that, as well as that myofascial system. And when sexual pain and dysfunction is left untreated, it has many side effects. And, I've kind of bolded the main things, but I'm sure many of you are feeling that sense of stigma, sadness, guilt, worry over your sexual pain and your role, perhaps even your role as a woman. And I don't deal with that psychological aspect of it, but in a sense, I do try to help support you by supporting the physical side of it and helping you find a support network for appropriate like psychosocial support related to pelvic pain and sexual pain. And I love this quote, which is from an OBGYN, from a book that she wrote. And despite the fact that no specialty is better qualified to render care for this consequence of cancer treatments, many OBGYNs feel uncomfortable or ill-equipped to address sexual pain in women affected by cancer. And, if you are having vulvar and vaginal pain, who else do you think you're supposed to go to if not your OBGYN? So this is where physical therapy steps in to help manage, because it really is, partly medical, but the medical management has occurred. What most of my patients need is physical therapy. And we determine what their specific needs are by looking at their history first. And we have to ask them even if they're coming in for sexual dysfunction, I'll ask about bowel and bladder function as well, because that's a huge integrated component with sexual dysfunction. All of those organs are right next to each other, and you can't really treat one type of dysfunction or pain without addressing them all simultaneously. And some of these symptoms that you may be experiencing in the genital region, you might say you have just like sensitivity. So like vulvar sensitivity from nerve injury or myofascial restrictions can occur. You might even feel like there's just recurrent itching, almost like you feel you have a yeast infection, but yet there's no presence of yeast. So itching is a really early sign of vulvar pain and can be addressed with physical therapy as long as there's an absence of an infection. And you might also just describe other things like delicacy or irritation. The introital epithelium refers to the vaginal epithelium. It dries and thins, like I said, in that menopausal state. And if you have a pre-existing mild prolapse, so that's where the organs are falling down, so your bladder, your rectum, your uterus, if you still have it, it's not as held up as tight in your pelvic cavity, so it's prolapse and falling down a little bit. And so you may have had something pre-existing, like a mild prolapse, a grade 1, for example, or grade 2, but you didn't notice it until that tissue became more thin, less pliable, and then now you're starting to notice it because you just have less structural support from that vaginal epithelium or that vaginal tissue. You may also notice discomfort in the urethral meatus, which is the opening of the urethra. So that's part of like a genitourinary syndrome of menopause that occurs with loss of estrogen. And those that are on aromatase inhibitors are especially at high risk for vaginal dryness and sexual side effects, with over 50% of women reporting dyspareunia, which is the medical name for painful intercourse. So with the physical therapy exam, we're looking at you both as the whole person that you are and taking into account these other orthopedic issues that you may have. For example, even like neck and jaw pain, back pain, hip pain, all of it's relevant to your initial visit. And we want to understand your whole picture. So that would be sort of like the external exam. And then there's a second part of the physical exam, which is the vulvovaginal exam. And the first part of that is looking at the structures externally and just seeing if there's any anything of concern, any irritation, any sensitivity. We sometimes might take a Q-tip and touch around the vulvar structures and just see if there's just certain areas that feel hypersensitive or if it's the area in general. And then depending on your sort of current status and clearance by your physician and whether or not you're getting radiation treatments, at the time we might also do an internal pelvic floor muscle examination. So this is not a assessment of like a PAP exam, for example, with the speculum. It is a one finger with a gloved hand assessment of the vulvovaginal structures and the muscles themselves. And we're feeling for differences from left to right, front to back, and seeing if it reproduces any of your pain. We're also getting a sense of whether or not you have like sort of what type of flexibility you have in your muscles, because really think of our pelvic floor muscles, which lie in a hammock at the base of our pelvis. As muscles. They are muscles just like your calves are muscles and just like your quads and hamstrings are muscles. And they need to be stretched and exercised like any other muscle in your body. So it's really taking an orthopedic approach to treating pelvic floor muscle dysfunction. And during that internal assessment, trying to decide where are the primary areas we should start to help you meet your goals. The posterior fourchette is an area that does get restricted in a lot of patients with painful intercourse. That's the bottom of the vaginal opening that would be above the tissue that's between the vaginal opening and the anus. That's referred to as the posterior fourchette. And we're also palpating it at rest, but then we're also seeing your ability to contract and isolate your pelvic floor muscles, as well as looking at your ability to rest and bear down, lengthen, and looking at overall pelvic floor muscle coordination. So this describes what I was mentioning, and I'll just get my arrow if hopefully it shows up on the screen for you. But this is that posterior fourchette area. And when I'm looking at the muscles that I'm assessing this muscle that goes around the vaginal opening, all the way from this midsection here to the front towards the clitoris. I'm also looking at this muscle and then some of these deeper muscles. And these yellow stringy things here are your nerves. So when muscles get tight, nerves can get entrapped, and that can give you symptoms such as like the itching or burning or sensitivity in that genital area. We'll also look at the clitoris itself and clitoral hood mobility, and making sure that there's movement in the tissue to help preserve that sexual function. And again, it's not just about the pelvic floor. I also am looking at you as a whole person. You have other muscles in your body. I'm so sorry. You are looking at the deep muscles in your hips. These are your hip flexors here and here. This is a deep low back muscle that you can palpate from the back and from the side. Looking at your breathing, diaphragm mobility is really important in pelvic floor function. And I have a video of that for you coming up in a minute. And just looking at you again as the whole person that you are, as well as doing the nerve assessment, which I described in the previous slide. Also included a lot of times is a lymphatic assessment. One of my physical therapists is also a certified lymphedema therapist. So she sees a lot of our post-cancer patients that have any lymphedema or swelling in the extremities. Breathing is hugely important, and I'm going to play this video for you as I discuss how our pelvic floor should work with our diaphragm or our big breathing muscle. And what's happening on this video to the right is that as you inhale, the diaphragm drops and lengthens. So this is the inhale, and we're getting a drop or lengthening of the diaphragm. And look what happens to the pelvic floor muscles down here as the diaphragm drops, the pelvic floor drops. So by just doing some like deep breathing, belly breathing, some nice lateral rib cage expansion, we can indirectly work on the pelvic floor just through breath to get length and mobility back in that tissue. When you exhale and your lungs are basically having the air pushed out of them with the diaphragm, the pelvic floor will lift up. So through a coordinated inhale and exhale, working on breathing is a really great thing that you can start doing on your own if you're experiencing any pelvic pain, pelvic issues, sexual dysfunction while you await a referral to a pelvic floor physical therapist. And I will say that many states do allow direct access, so you don't need a prescription from your physician to at least be evaluated. And very, depending on what state you're in, sometimes you do need a prescription to have follow-up visits, but that does vary state to state. And I'm in California, and we can have 12 visits with someone or see them for a 45-day period before we need a referral from their doctor. And now I'm trying to just get to the next slide. There we go. Really the most important part of doing the evaluation is so we can determine what your primary goals are, because we always want to work within your goals, and then develop an individualized treatment plan for you. And when we're talking about restoring sexual function, we're usually talking about using medical dilators, which I have on a slide coming up, but they are medical devices that start very thin and get gradually bigger, so that you can start to restore tissue mobility and flexibility in those vulvar vaginal tissues. We might do scar tissue techniques for any restrictions that we note there on the initial evaluation. Also addressing that orthopedic dysfunction at the same time, teaching you proper breath work, and just, all of those things to help you lead a more satisfying sexual health experience. Lubricants are something that I talk with a lot with my patients, and especially my patients that have a loss of estrogen suddenly due to having some estrogen receptor positive cancer. And so here is a list, and please screenshot this as well, to avoid certain lubricants, and parabens being one of the big ones because of the knowledge of them acting as an endocrine disruptor, and that it may act like estrogen in the body. So always making sure that your lubricants are paraben free. And then these other chemicals are more so because they can be irritative or increase your risk of yeast infection or alter your pH. So just watch out for those other 4 things as well. And then instead, I really like the following brands, and I'm not paid by any of them, so feel free to order at will. But these are ones that I do use in my office and I'm very fond of for my patients. So Beeswax cubes is something that I learned about when I did a breast cancer support group, and I don't have any personal experience with them, but several of the women at the last support group I led said that it was wonderful. And so there's the information on ordering those, and I would love to hear your thoughts as well. And you can please email me. I'll have my contact information up on a slide, and would love to hear your favorites and personal experiences as well. From the medical management side, there are topical or compounded medications that they can use, including hormonal therapies, which of course is very controversial. The cancer physicians will say absolutely nothing containing estrogen, whereas the urogynecologists, which are female pelvic medicine specialists, will say that some estrogen is okay. So it's controversial, and it really becomes a discussion of your priorities. And if you have a loss of sexual function and that might help you restore some of that, then it's just having all the information at hand and making the best decision that you feel you can make for you, giving the information you have. Please do screenshot this, and I would just like you to self-reflect on these questions. And if you're answering yes to more than a couple of them, then then reach out to me or reach out to a local pelvic health physical therapist and start restoring that function, because you deserve it, and we can help with all of these things. Here are some resources for you. I did write a book, and it's available on Amazon or on sexwithoutpainbook.com to help restore sexual function. It's not written specifically to cancer survivors, but the techniques can all be applied in the same way. And then this is a picture of dilators, medical dilators, and they have both rigid or plastic dilators on the website, as well as these ones are silicone. These are made in the USA, which I find lovely, and that's why I like to support them. But I do have a discount code for you where they will provide that discount, and they also do have a lot of lubricants on there as well. As far as what type of dilator to order, in all my patients that are receiving radiation to the pelvis, I do recommend silicone dilators because they're just softer and better tolerated than the rigid plastic ones. Please also screenshot these next set of resources. These are patient and provider resources for addressing sexual concerns related to cancer that I found on the NIH website. So please do screenshot this, and I'll just give you one moment, and get ready to screenshot the next page as well, which are more resources from the same NIH page. I would also like to offer everyone a discount to my PDF download of my book with this code, and that's the letter O, and then it's a 20 at the end. But again, you can get it at Amazon as well. And please do keep in touch with me and offer you any support that you need. I'm very active on Instagram, and those are the two accounts. The Lady Parts PT is my primary Instagram, and Femina PT is my female-based physical therapy and wellness platform. And so we're very active on those two platforms. So please, everybody, just know that your sexual and your pelvic health matters, and that I believe that you should have access to these services, and that it's not something that you have to resign yourself to. This new state of normal, you can be proactive and help take charge of your sexual health. So don't afraid to be an advocate for yourself, as I'm sure so many of you are very well practiced at this point in being an advocate for yourself, and know that you do have options. And thank you so much for listening to my presentation, and that's all. Thank you. Bye-bye.